Hello and welcome to Morton Hospital's Total Joint Replacement Program. This is your guide to your total joint replacement surgery. My name is Gina Martello and I am your orthopedic nurse navigator here at Morton Hospital and will be narrating this PowerPoint presentation for you. You may find it beneficial to download our surgery guide as it is referenced throughout this presentation. And please note that you will receive your hard copy of our surgery guide at your upcoming pre-admission testing appointment. Thank you so much for choosing Morton Meese to have your total joint replacement surgery. Let's get started. Welcome to the Doyle Tower. On the second floor of the Doyle Tower is where you will get prepped for surgery, have your surgery, and recover in our post-anesthesia care unit or recovery room. The fourth floor of our Doyle Tower is where you will stay after surgery until you are discharged from the hospital. We have two sides of our orthopedic unit. Our Doyle Tower consists of 21 beds and our Adler side consists of 31 beds. All of our beds on our orthopedic unit are private and again is the room you will be in until you are discharged from the hospital. Here at Morton Plant, we do have clinical pathway excellence for our total hip and knee replacements. On average, we performed about 1,900 total hip and knee replacements here each year. We do utilize cutting-edge technology and techniques, which allows most patients to leave the hospital the day after surgery. Patients who leave the hospital, 95% of those are going home with home health care, so we are sending more patients home today. Pain management techniques include a multimodal pain approach, which helps to decrease pain medication consumption after joint replacement surgery. This will be enhanced on future slides and discussed further. We are a tobacco-free campus here at Morton Plant, and we are promoting a healthy lifestyle. Please, no smoking on campus, and our surgeons do recommend that if you are an active smoker, please try to quit prior to surgery. No surgical procedure can take place without us first taking a good look at your overall health. You will have an appointment with your primary care physician prior to surgery and will require to be medically cleared. Some of you may be required to see a specialist in addition to your primary care, such as a cardiologist or pulmonologist. If you are required to see a specialist, you will require clearance from that physician as well. You will also receive a phone call from our pre-admission testing department, and you will have an over-the-phone interview with them. They will be going over healthcare directives, medications, and instructions to follow. They will ask that you have a current list of your medications available, such as prescribed medications and anything you take over the counter. Per our anesthesia guidelines, there are certain medications that may need to be stopped prior to surgery, and the nurse who works with you will be able to direct you on which medications for you to stop or continue taking. Typically, vitamins, supplements, as multivitamins, fish oil, and herbal supplements need to be stopped about 2 weeks before surgery. All NSAIDs such as ibuprofen, Motrin, Aleve, naproxen, as well as aspirin need to be stopped about 1 week before surgery. If you're on a specialty blood thinner such as Coumadin, warfarin, Xarelto, or Eliquis, you will receive special instructions on when to stop your specialty blood thinner. Please note that Tylenol is safe to take up until the day before surgery. During your over-the-phone interview, they will also make a pre-admission testing appointment for you here at Morton Plant. They typically have you come in 3 to 4 days before surgery to have your MRSA, MESA, and COVID-19 nasal swab completed. They will also provide you your Dynahex cleanse and complete any blood work and an EKG if it has not already been completed. We do like for you to have your blood work completed prior to this appointment here at the hospital, as we like to ensure all of your blood work is acceptable to proceed with surgery. Our surgeons also ask that you please notify them immediately if you have any medical condition changes prior to surgery, such as a cough that just won't go away, if you're running fevers, burning with urination, urinary frequency, or urinary retention. We wanted to share with you what we are doing here at Morton Plant Hospital to prevent the spread of COVID-19. All patients coming in for elective surgery are required to have a COVID-19 nasal swab completed. Any positive results will need to be rescheduled to have surgery at a later date. Please note that once your COVID-19 test is complete, we ask that you self-isolate and only associate yourselves with those of your immediate household. Our staff members are also required to wear masks at all times. On the orthopedic unit, when a staff member enters your room, they will be wearing a mask as well as goggles while they care for you. At this time, we are allowing visitors, one visitor per patient in the pre-op area, and then once the patient is on the orthopedic unit, you will be allowed to have one visitor between the hours of 1 and 8 p.m. Please note that things are constantly changing, as well as our hospital adapting improved protocol and policies to keep you safe, our staff members safe, and our community. As you prepare for your surgery, we would also like you to prepare your home. Page 22 of your book has other examples. For example, we would like for you to remove tripping hazards such as throw rugs, loose cords, any clutter. Meal preparation, so going to the grocery store, doing some meal preparation, or easy to make meals. Moving frequently used items to countertop or waist level so they're at more height friendly. Then what to bring to the hospital. Page 23 of your book does have an example of this. We do provide all toiletries for you, even a hospital gown and socks. However, if you'd like to bring your own clothing, that is welcomed and allowed. Appropriate clothing is loose fitting, such as elastic waistbands, nothing too tight or binding around your hip or knee incision area. Electronic devices such as your cell phone, iPad, tablet, glasses, contacts, dentures, hearing aids, CPAP, or a BiPAP machine are welcome as well. Please do not bring to the hospital any jewelry or valuables, and also no home medications. The only home medications you will be allowed to bring in are eye drops and inhalers. Your hospital stay. We want to keep you safe during your stay here. We will be asking you frequently to state your name and date of birth and comparing what you tell us to your hospital wristband that is provided to you upon admission on the day of surgery. We do like to prevent infections, so hand washing is very important. We do ask that all staff members, visitors, family, friends to wash their hands before and after entering and exiting your room. Our surgeons will also be giving you IV antibiotics, 1 dose before surgery and then 2 doses after surgery once you're up on the orthopedic unit to help decrease infection after surgery. Our surgeons will also be confirming the correct surgical site, confirming the right procedure with the right patient and the right site. The day before surgery, you will receive a phone call from Morton Hospital between 2 and 7 p.m. During that phone call, they will instruct you to please remain nothing by mouth after midnight, so please no eating or drinking. If you have certain medications that are safe to take the morning of surgery, you will take those with a small sip of water, just enough to get those medications down when you first wake up. If you are a Monday surgery, please expect a phone call Friday afternoon between 2 and 7 p.m. When you arrive to Morton Hospital the day of surgery, you will arrive at the east entrance. You will then be escorted to the second floor of the Doyle Tower, which is our pre-op check-in holding area. They will put an IV in you and get a set of vital signs, blood pressure, heart rate, respiratory rate, and temperature, as well as get a hospital gown and socks for you. Any and all belongings that you come into the hospital with will be securely locked up during surgery and returned to you once you are out of surgery on the orthopedic unit. You will also meet with your surgeon and our anesthesia team at this time. They will discuss the type of anesthesia that will be used while you are in the operating room, and they will also be discussing a nerve block with you. Nerve blocks are designed specifically for total knee replacements to assist with pain control after surgery for a specific amount of time. Once your surgeon and OR are ready for you, you will be taken back to the operating room. Typically, surgery can last anywhere from 1 to 2 hours. It just depends on what your surgeon needs to do. Once your surgery is completed, you will be transferred over to our post-anesthesia care unit or recovery room. There you will meet your recovery room nurse, and they will be taking your vital signs pretty frequently, about every 15 minutes. They will also be assessing your pain control. If you wake up in a lot of pain or discomfort, they can administer IV pain medication that works rather quickly. Once your vital signs are stable and your pain is under control, this can take anywhere from about 1 to 2 hours. You will then be transferred up to our orthopedic unit on the 4th floor of the Doyle Tower. Here you will meet your bedside nurse and a patient care tech who works under the direction of your registered nurse. They work together as a team during your stay here at Morton Hospital. And we do have day shift and night shift available, so you will have staff members assigned to you at all times. Your nurse will be assessing your pain level once you get to the orthopedic unit from the recovery room. We give high doses of Tylenol every 8 hours around the clock, and then incorporate narcotics as needed. As needed is the key component here. If you don't need them, you don't have to take them. However, if you do need them and your pain level is a certain amount, we can then incorporate your oral narcotic that your surgeon has ordered for you as needed. We will also be advancing your diet and we'll be starting you off on a clear liquid tray. Chicken broth, beef broth, Italian ice, and Jello. Those are all things that are easy to digest after surgery, and if you can tolerate that clear liquid tray, we can generally advance you to a regular meal the same day of surgery. Our physical therapy team will also be coming in to see you the day of surgery. They will take you for a short walk, and our goal is to walk you about 20 to 30 feet with a rolling walker. Some patients can do a little bit more, and that's great, and some patients can only do a few steps. All we ask is for you to do your best and expect our physical therapy team to visit you the day of surgery to begin your rehabilitation program. You may also have a medical doctor consulted to ensure that you are medically cleared prior to discharge. This is based off of your surgeon's preference and protocol. The day after surgery, a staff member will be getting you up to the chair for breakfast. Breakfast usually arrives between 6:30 and 7 and is pre-ordered for you the night before. You may also see your surgeon's team as well as a medical doctor if they were consulted to see you during your hospital stay. Physical therapy comes by and will be taking you for a walk, hopefully longer than you did the day of surgery, and then get you back to bed to do some post-operative exercises. Physical therapy may recommend that they see you a second time that afternoon, but some patients do well enough that they are cleared from physical therapy after their morning session. If an occupational therapist comes to see you, they do focus on activities of daily living such as functional mobility, bathing, and grooming. This is all dependent on your surgeon's preference and protocol, as not every patient may have an occupational therapist. We do like to remove lines and drains the day after surgery. One of those lines is a nasal cannula delivering oxygen. Getting you up and moving and using your incentive spirometer at your bedside will aid in removing this line. We do like to take out IV lines prior to discharge. IVs deliver IV fluids and medications. And another line that comes out the day after surgery is a Foley catheter. Not every patient receives a Foley catheter, and if you do have a catheter in place, it is placed in the OR while you're asleep and then comes out the day after surgery. One drain that may be in place, dependent on your surgeon's preference and protocol, is a hemovac drain. This is placed in the OR and helps to remove old blood from surgery. Once the output is under a certain amount within a certain time period, your surgeon will give an order to your nurse to have this removed prior to discharge. Pain is common and to be expected after surgery, and it is good to understand that pain cannot be taken away entirely. However, there are things that you can do to help alleviate your pain and make it tolerable during your initial recovery. By utilizing our multimodal pain techniques, it can assist in making your pain more comfortable. For example, your surgeon will be ordering Tylenol around the clock and narcotics only as needed. We are working towards a reduced opioid consumption after joint replacement surgery, and our multimodal approach has helped reduce pain with other techniques, ultimately decreasing narcotic needs. Other medications that are utilized are anti-inflammatories and low-dose steroids to help reduce swelling and pain initially after surgery. We also give you black ice wraps here in the hospital to continually ice your hip or knee. This ice pack does get to go home with you, so that way you are able to continue icing once you leave the hospital. Elevating your legs above your heart can also help reduce pain associated with swelling, as well as early ambulation and continuing to walk on the new hip and new knee to help it heal. Again, by using several techniques together as a multimodal approach, this can help your pain become more tolerable during the temporary painful period after surgery and hopefully reduce your narcotic need. As you recover, pain should improve over time. This is our communication board. We do want to ensure that your safety is our top priority. You are all a fall risk, and we know that it is not safe to get up on your own without a staff member's assistance. Please do not hesitate to call a staff member if you need to get up out of bed or get back to bed. We want to ensure that we are with you to help reduce the risk of falling. The worst thing you can do after surgery is fall on your new hip or new knee. To the right of this PowerPoint is our patient communication board. This is going to be in your hospital room and does communicate key information for you each day that you are here, including your care team's information, your medication information, what time you can next expect this medication, as well as important contact numbers. This is our Get Well network. This is our TV educational component in one. Our home screen here does provide learning about your medications, browsing healthcare videos, and seeing your medications, movies, as well as your TV channel guide. Please note that when you first arrive to your hospital room, you will have 3 mandatory welcome videos to watch. Once you watch those, you can access this Get Well network. For your remainder of hospital stay, physical therapy will work with you every day that you are here to ensure that you're cleared from a physical therapy standpoint prior to discharge. We do have a multidiscipline approach when it comes to ensuring that you are safe for discharge. That includes our bedside nurses, our surgeons, their mid-level staff, our PA here, as well as our charge nurses, myself. All of our care team work together to ensure that you are safe upon discharge. We would like for you to start thinking about, where are you going? Are you going home after surgery? Do you have help at home? Have you gone and done your meal planning and prepping? We want to ensure that everything is done ahead of time so that way when you come in for surgery, the transition home is smooth and pain-free. Our average length of stay after total joint replacement surgery is about 1 to 2 days. We also like to provide discharge time for you. On average, most of our patients do leave the hospital between 11 a.m. and 3 p.m. We will know a better discharge time for you when we do reach your day of discharge, and our care team will be communicating with you a better time frame. But we just like to give you this to prepare ahead of time so you can have a ride ready. We do have some new take-home medications for you to be aware of. Your surgeon will be prescribing these for you to continue taking at home, as well as becoming familiar with them while you're here in the hospital. Pain medication include narcotics and opioids. Common side effects are constipation, nausea, vomiting, and itching. Your surgeon will be prescribing a stool softener to be taken every day that you're on pain medication, as well as an anti-inflammatory to help reduce normal swelling that occurs with surgery. Everyone will also be on a blood thinner, either an injectable or an oral. Our most common oral blood thinner is aspirin. It's usually a baby aspirin twice a day for 30 days. Our injectable blood thinner is Lovenox, and we also have other oral blood thinners such as Xarelto or Eliquis. Please note that if you're already on a specialty blood thinner prior to surgery, your surgeon will be likely resuming you on that normal blood thinner that is known to you. This is our orthopedic discharge card. This card will be provided to you before discharge. It has your name, your surgeon's name, what type of surgery you had, what day, and where the surgery was performed at. This is to help to show providers in the ER that you just recently had surgery. We do try to prevent readmissions after surgery, and we want you to stay home if we can help it. However, we do understand that life does happen and sometimes an emergency may occur. If you do need to come back to an ER after surgery, once you are home, please show this card to your ER physician so they can notify your orthopedic surgeon that you may need to be readmitted to the hospital. Please know that not everything is an ER visit or warrants an ER visit. For example, pain concerns, infection concerns, wound concerns, please notify your surgeon's office first. However, if you do experience chest pain, shortness of breath, or you fall, you will want to return to an ER to have emergency care. Please refer to page 47 of your books. This is just an overview again of your length of stay and what to expect while you're here. Publix Pharmacy does offer a bedside medication delivery service. And this is for the new prescriptions that your surgeon will be prescribing for you to fill and continue taking these medications once you leave the hospital. They do accept most insurances and are open every day of the week. A lot of our patients do utilize this service as it's more of a peace of mind knowing you have everything you need before you leave the hospital and before you get home. If you choose to use this service, our staff will be sending the prescriptions and your insurance information to the Publix pharmacy. The pharmacy will then call you in your hospital room to notify you your medications are ready, as well as if you have a payment based off of your copayment availability. They do take debit card, credit card, cash, or check, so if you do want to use this service, please ensure you bring a form of payment available to pay for these medications prior to discharge. After your surgery, your blood thinning medication will continue typically for about 30 days, but please follow your prescription information. You will have your follow-up appointment with your surgeon in about 2 weeks, and that is when they will discuss driving release. Please do not drive or operate a vehicle if you're still taking narcotic medications, and please ensure that your surgeon has cleared you to do so. Dental work. We do ask that you hold all dental care, including cleanings, for 6 weeks to 3 months. After that period of time, you can resume all dental care, but will need a dose of an oral antibiotic prior to your surgery to help prevent infection around your hip or knee replacement. Typically, your dentist's office can call this prescription into you, but you do need to notify them that you have had a recent hip or knee replacement so they are aware and can prescribe this medication for you to pick up at your preferred pharmacy on the way into each procedure. We also ask that you please read the infection prevention flyer located on the back of your books. We really want to help infection after total joint replacement surgery. Once you are discharged, if you have provided the hospital with an email address, you will receive a link from the hospital to access your medical records online. If you do not have access to an online patient portal, please know that you can contact our medical records department for any records you may need once you are discharged. We always want to provide our patients with high quality care. Please take a brief moment to fill out the survey that is mailed to you after surgery to let us know how your hospital experience was. Home health care coordinator will be coming in to see you while you're here in the hospital. Home care is set up after surgery once you are in your hospital room, and your home care coordinator will be coming to visit you, going over your surgeon's preference for home care agencies, as well as which agencies your insurance is contracted with. You must be homebound status if you receive home health care. Basically what that means is you do need to be home during that 2-week period of time, and please not out driving yourself. The reason we recommend this is that if your insurance sees you as too independent, you may no longer meet home care criteria and you may be discharged early. Medicare does cover home care 100%, and everyone will be getting physical therapy visiting in their home after surgery to continue their rehabilitation. Physical therapy typically comes 2 to 3 times a week for the first 2 weeks, and then you'll be seeing your surgeon at your 2-week follow-up and discussing therapy from there on further. Some of you may be having nursing visits. This all depends on your surgeon's preference and protocol. If you do have a nurse, they will contact you as well for care. Scheduling visits occurs once you are discharged from the hospital, typically 24 to 48 hours from your discharge. You will get a personal phone call from your physical therapist and nurse, if you have one, letting you know what time they plan to arrive to your home, and then we'll be getting you on a set schedule from there on forward. For durable medical equipment, physicians will be ordering your DME, and if you do not already have durable medical equipment, it will be delivered to your hospital room and your insurance will be billed so that way you have your equipment prior to discharge. If you already have equipment prior to surgery, you do not need to purchase an additional set, and you do not need to bring it to the hospital, as we have all equipment for you to borrow while you're here. Medicare covers the 2-wheeled rolling walker and bedside commode 80%, 20% will be billed to secondary insurance. If you do not have Medicare, for example, Humana insurance, the 2-wheeled rolling walker is the only DME covered item. So please note, if you do need a bedside commode or think you will need one, Humana will not cover it, so you will need to purchase this out of pocket. Now there is a 5-year rule, so if you do go through insurance to receive any DME, please hold on to it for at least 5 years. If you need it again within a 5-year period and you no longer have it, insurance may no longer cover it for you. These are the two equipment items that our surgeons will be ordering for you, the two-wheeled rolling walker and the bedside commode. The bedside commode, we ask that you remove the bucket from that commode, as it is removable, and to place that commode over your toilet and your bathroom. This will allow an easier way for you to get up and down off your commode, especially if you have lower commodes. If your commode is a higher commode, you do not need to purchase this bedside commode. You can simply decline it, but we do offer this option for you if you feel like you may need it. Hip kit. This hip kit is provided to you. Insurance does not cover this, and this is completely optional. Hip kits are used to help with activities of daily living. We have our sock aid at the top left that helps you get your socks on your feet, your dressing stick in the middle on top that helps you to get your clothing items on, hook underwear, drawers, things like that. Elastic shoelaces on the top right, that helps you to pre-lace tennis shoes so you don't have to tie or untie your shoes each time you put them on. The shoe horn is at the bottom left, that goes onto the back of your tennis shoe to help you get your heel into your tennis shoe easier. In the middle on the bottom is your reacher. We do sell this separately, but if you get the kit, this will come in the kit. This helps you to pick up items that you may have dropped and can also be used for dressing purposes. And the last item is our long-handled sponge, help you to do lower body bathing and washing your back while showering. This hip kit is about $24 and change. We will not ask you to pay us while you're here. You will just receive the bill once you are discharged from the hospital. Again, it's $24 and change, and insurance does not cover this item. For showering, we do recommend shower chairs for walk-in showers and tub transfer benches if you only have a tub shower available. This gives you a safe place to sit down or transfer in and out of your tub easier, again helping to reduce the risk of falling and safety while bathing and showering. For fall prevention, just some key items here. Again, removing items from your pathway and throw rugs, moving frequently used items at your countertop or waist level, making sure all areas of your home have adequate lighting, and wearing shoes inside and outside your home. Installing safety bars in your bathrooms if you need them. Non-slip mats in the shower or tub are recommended. Handrails by your stairs if you need them. Carrying your cell phone, and being aware of your pets in your pathway when walking. If you do get a two-wheeled rolling walker from Baycare DME, we do provide a blue bag on the front of your walker to help transport items safely. Online, they do sell walker baskets and trays if you'd like to have any additional accessories for your walker. I do recommend Amazon.com or Walmart.com for any DME that may not be covered with insurance to help save some cost. Starting on page 27 through 29 of your books is our physical therapy exercises, but just to start off here, some physical therapy expectations. They will be getting you up on the day of surgery and will be walking the day of surgery. Exercises do begin the day after surgery. Physical therapy does focus on transfers, getting in and out of bed, for example, going over stairs if you have any stairs, even if it's one step to go into your home. They will be practicing that with you to ensure that you are safely able to complete it before discharge, as well as getting you up to the chair for meals. Pre-op strengthening exercises do begin on page 27 of your book, and these exercises are page 27 through 29. We do ask that you do these exercises prior to surgery, twice a day, 10 repetitions each exercise. If they do have you hold for a count of 5, you want to count to 1, 2, 3, 4, 5, and that's when you want to hold for a count of 5 and then relax. Again, we do recommend 10 repetitions twice a day, every day before surgery. Page 30 of your book does finish the exercises, starting with the sitting kicks through the hamstring sets. We want to make sure, again, you do continue these, as these pre-op strengthening exercises do help with muscle memory and strengthening prior to surgery and are very similar to the exercises you may be doing after surgery while you're here in the hospital. Our physical therapist also asks that you do an at-home checklist. Do you have stairs? How many and where? Railing. Off those stairs, do you have railings on one side, both sides, or no sides? What are your chair and toilet heights as well as your bed height? What side do you get out of on your bed? These are all things they have you start to think about ahead of time. So when you're working with them here, they're going to ask you these same questions so we can mimic home as much as possible for you. Stairs. We do recommend up with a good, so up with your non-surgical leg and then down with your bad which means down with your surgical leg. Page 35 of your book does explain this further, but again, please note that you will practice this in person with our therapy team if you do have stairs at home. For car transfers, we do have a car simulator, and page 36 of your book does show an example of how to get in and out of a car. We do recommend that you also note your car height, that you know the car that you're going to be going home in. We can adjust our car simulator to the height of your vehicle to ensure that you are safe transferring in and out of that vehicle. Lastly, to finish up with physical therapy portion, going home safely. We want to ensure that you're cleared from a physical therapy standpoint, and their criteria to clear you to safe to go home is the following. Are you able to get in and out of the bed with minimal or no assistance? Can you walk 100 to 150 feet consistently with a two-wheeled rolling walker? Can you get to the bathroom and get on and off of the toilet? And if you have stairs, can you complete those stairs? Most of our patients can complete this criteria successfully within 1 to 2 days after surgery, and we will be working with you to ensure that you are meeting goals. Thank you for taking the time to review our virtual total joint replacement class. Please find on the next slide my contact information, and do not hesitate to reach out to me if you have any questions or concerns. I will also be placing a follow-up phone call to ensure that the video has been viewed, as well as again providing an opportunity to answer any questions or concerns. Thank you very much, and we look forward to having you here at Morton Hospital for your total joint replacement surgery.